Okay, so let's go over what we covered today. We started this course with understanding the pathophysiology of infertility. And one of the things I put up in the very beginning is this clock. It's a ticking clock. And the first thing that I really wanted to emphasize was you have a limited amount of time before a female will lose their ovarian reserve. Once they lose their ovarian reserve, that's it. It's not going to happen. And I showed you a lot of studies where we showed oxidative stress, chronic inflammation can have a significant impact on impacting the ovarian reserves. And this was the list right here. So mechanisms that reduce egg quantity and quality. Age is one of them. The timeline where everything goes south is 35. Once a woman starts to get past 35, some of those studies showed there's only 6% of healthy eggs left that has the potential to lead into pregnancy. So really ages between 20 to 30 are the ideal periods to reduce risk factors and have the highest probability of having birth. So age is one of the things that can impact ovarian egg quantity and quality. Endocrine imbalances, hypothyroidism, decreased FSH, increased androgens, increased prolactin, they could all impact egg quality. Oxidative stress, air pollution, environmental toxins, cigarette smoking. The more oxidative stress the female has in their lifestyle, in their lifespan, the more inflammation they have, the faster they lose their ovarian reserves. So if you have a female that's smoking cigarettes all the time in their 20s, they're involved with air pollution, they took drugs, they did a lot of alcohol, they may get to they may get premature ovarian failure. That does happen. Medications, these are heavy-duty anti-neoplastic medications or autoimmune medications or steroids. Those can impact ovarian quantity and quality. Some women have genetic disorders where they're prone to getting premature ovarian failure. And then endometriosis. Endometriosis has been shown to cause inflammation and promote inflammation and loss of egg quantity over a period of time. So that's one of the first things you have to remember. The fertility game is a ticking clock, all based on ovarian reserve. The older the patient is that comes into your office with these risk factors, the less time you have to play around, okay? The younger they are, the more flexible and more time you have to make some kind of change. But ovarian reserve is the key thing. Now, in part 2 of the course, I'm going to share with you how to measure ovarian reserves through laboratory testing, how they measure it in fertility clinics, so you can get an idea of where they're at. If you need to evaluate that piece of information, but that is significant. Now, the other key thing that we talked about was when you look at infertility, you got to look at what the World Health Organization found in a multinational study to look at the etiology of infertility. So 25% of them have ovulatory disorders. As a clinician, this is going to be obvious to you. Here's what they're going to tell you. I don't have regular menstrual cycles. I don't have a menstrual cycle. As soon as they tell you that, you know that they have an ovulatory disorder. We're going to go into a step-by-step approach with evaluation of labs and history to figure out what's causing the ovulatory disorder. But the most common one is PCOS. Hypothyroidism is also very common. Low and high BMI is also very common. But you can't improve fertility until you normalize menstrual cycles. So 1 out of 4 patients that have infertility will have ovulatory disorder as one of multiple things that's promoting their infertility. So you definitely want to be aware of that. 15% of women have endometriosis. Your biggest clue they have endometriosis is that they have pelvic pain. They have pelvic pain, especially before their periods. They have pain whenever they have sex. They have pain sometimes when they get inflammatory foods in their diet. If they're eating lots of fried foods, they feel a lot of inflammation, a lot of pain. If they're having a diet that's high in partially hydrogenated fats, lots of fried foods, lots of red meats, very low in healthy fish, and anti-inflammatory prostaglandins, they're probably going to have pelvic pain all the time. So endometriosis is something else you need to look for. This is all about prostaglandin imbalances as a key part of calming that response down. Now, hyperprolactinemias, which is 7%, are going to be part of ovulatory disorders. So if someone's not having has completely lost their cycles, it's always important to measure prolactin levels. A lot of people in the population have these benign tumors in their pituitary called prolactinomas. And the drawback with those prolactinomas is that they increase prolactin release, which shuts down FSH and LH. Now, I have a large subset of patients in my practice that have neurological issues. So a lot of times when I see some of my patients, there'll be reasons why we need to do a brain MRI. Maybe because of exam findings, maybe because of their history. And I can tell you, we see prolactinomas, benign prolactinomas show up all the time. Not all of them cause prolactin increases. At some point in their lifespan, they have the tumor, but all of a sudden they start putting out prolactin. So if they have a prolactinoma, dopamine agonist medications seem to have an effect. I don't know of anything nutraceutical that's consistent or has a major impact on prolactinomas, but a dopamine agonist fixes the prolactinoma and can normalize menstrual cycles right away for many patients. The other key thing we talked about in the first part of this course is make sure that a proper gynecological exam is done to look for pelvic adhesions and tubular blockages, any anatomical issues. And this slide is focused on females, but also in males. Now, the other important thing to remember from the concepts of today is there's lots of different mechanisms that impact fertility. Your goal as a clinician is to find as many of them as you can. It's pretty rare that it's just one, okay? The more mechanisms you can find and can address, the more successful you will be with the case of infertility. So I made a checklist to help you not miss any of the major ones, and we'll share that with you in part 2. And you can go through and make sure each of these factors are accounted for. Remember when you look at the flow chart for typical fertility workup in females, most of the focus is on, do they have normal menstrual cycles, and do they have hypothyroid, do they have any prolactin issues, or do they have any anatomical changes? And if they do, basically they recommend IVF or drugs that promote ovulation. They totally overlook things like TPO antibodies. There's no rule of consideration for dietary factors like prostaglandin, despite the literature. They don't really look at things like blood sugar issues, the microbiome. They don't look at things like autoimmunity as a factor. So lots of patients that have gone through this workup end up being diagnosed with, we don't know why you have it. Now, a lot of times in this workup, they're going to catch the obvious things like PCOS or endometriosis or uterine fibroids. So you definitely want to make sure that if you're doing functional medicine, at some point though, the patient has gone through a conventional fertility workup, especially to look at anatomical issues like gynecological ultrasound to see if there's any masses or growths that can get in the way, or things that are called cervical factors, uterine factors, or tubal factors. With males, the approach is just to measure sperm. And if sperm is abnormal, then to consider testosterone replacement, or to consider intrauterine insemination or IVF therapy. And when you're looking at that mechanism, realize that a lot of these studies show you may not see changes in semen analysis. For example, TPO antibodies, for example, oxidative stress responses, but the actual sperm has DNA fragmentation loss that can lead to things like miscarriages, that can lead to things like epigenetic effects and transgenerational responses. So whether the semen analysis is normal or abnormal, you definitely want to include diet, nutrition, lifestyle strategies to improve sperm function like we talked about. If it's abnormal, you can change their lifestyle, add a nutraceutical cocktail to their protocol, look for underlying mechanisms. We'll talk about that more in part 2. And then retest and see if they can improve. Now, the other key thing is when you look at how infertility patients and couples come into your office, there's all these different types. Some come in because early, they just want to improve their health. Maybe they're already patients of yours and they go, hey, I'm thinking about having a baby soon. We want to know what we can do. always remember there's a male factor, a female factor. In some cases, you may start with the female and just deal with maybe they don't have a cycle and then work into male factors and other things. There is no, one way for everyone. Some patients have been gone to the fertility clinics and told there's nothing wrong. Some patients already know they have endometriosis or PCOS, but they've overlooked it, don't think it has a factor. Some patients that failed IVF. Some patients want to go into IVF therapy. There's a whole spectrum of different types of infertility clinical scenarios that you may need to deal with. At the end of the day, you can really think of it as 8 steps from beginning to end of how you really support a couple through infertility. And this is really highly emphasizing the female factor. Rule out anatomical causes first. Make sure they have normal menstrual cycles. Normal menstrual cycles means the timing is the same each month. It's pretty consistent. They don't have any missed cycles. Optimize tissues like sperm, the follicles, reproductive mammary like peritoneal fluid. Optimize maintaining a pregnancy. We're going to talk about that more tomorrow. Tomorrow is all about steps 3 to 8. So part 2 of the course, we're going to talk about optimizing and maintaining a pregnancy, looking at understanding risk factors for miscarriages, and then looking at things that impact fetal health development and complications and childhood disorders and recovery and so forth. Everything that we focused on, the pathophysiology, was knowing what tissues are involved, how they can be impacted by physiological responses, anatomical pathways that get in the way, and then coordinated signal responses. And we also talked about, semen analysis and how there's different variables that we need to check. Those were all part with part 1. Then we got into part 2 and said, listen, everyone's going to have more than one risk factor. That is infertility. You're going to have to try to go through your workup and try to figure out what other factors are involved with their infertility development. Are the things that are impacting the feedback loops? Are the things that are impacting reproductive tissue? Or the things that are impacting hormone and immune integration? And each person will have its own web or list of risk factors that you need to identify and develop a protocol for. Each infertility patient is going to be uniquely different. And then we talked about diet, nutrition, and lifestyle. We talked about how each of these factors on the left-hand side impact both male and female reproductive pathways. And we talked about specific risk factors with females that involve PCOS, uterine fibroids, and endometriosis. We talked about lifestyle factors that impact sperm health. And then we ended each section of those conditions with a summary chart that explains diet, nutrition, and lifestyle for uterine fibroids, sperm, endometriosis, and fibroids. And then lastly, we talked about nutraceuticals. With nutraceuticals, we talked about the importance of nutraceuticals for general mechanisms that involve with fertility, essential fatty acids, blood sugar stability, biotransformation, microbiome, and then specific conditions like whether it's sperm dysfunction, PCOS, uterine fibroids, or endometriosis. And then we went into things that may impact the pituitary, estrogen pathways, adrenal pathways, and so forth. That is kind of the big picture of the general overlay of infertility, okay? Now, I understand at this point, it's just a bunch of information. That's okay, you have to start somewhere. What I'm gonna do in part 2 is I'm going to, now that I have given you the overview of the pathophysiology of risk factors, of nutraceuticals, and how diet and nutrition impact them, is we're gonna slowly move into how we can switch and go through each of these steps. And then how to take a person all the way through to step 8, and then how to use what's called a fertility assessment form, an infertility checklist, develop an individualized, personalized protocol, how to monitor their cases, and then I'll go into some case reviews and case studies for you as well. So those are the key concepts for this first part of the course. Okay, it's just general information without the specifics of how to totally apply it yet, okay? Now, let's take questions that we have.